Good afternoon, everybody. We're just going to give those that are still joining a couple of seconds to finish joining, and then we'll be starting the session. If I could just ask people to put their mics to mute, that would be great. And it's always great if people can put cameras on so we know who we're talking to, but I understand some people may not wish to have their cameras on. But for those of you who can, it's always great to see you. Right, I am going to get started. So good afternoon, my name is Richard Ayres and I am a social care advisor here at Care England, and I want to welcome you to the joint Citation and Care England webinar, which is designed to help care providers focus on and to improve their CQC ratings. So Care England have been working with Citation now for nearly 13 years, and we continue to work with them because we believe that we benefit greatly from the diversity of their work. We're delighted also to be joined by our leader, Professor Martin Green, OBE. He's our very own CEO, and he will very shortly open the session today and share some of his thoughts on the current CQC regulatory position. And I will then hand you back over to Mick Feather, a former CQC inspector, and Flora Neville, an associate speaker from Citation, who will introduce themselves and then take you through their takeaways from 2024 inspection reports, which should help inform forward planning for care providers. They'll talk about the impact of the new CQC single assessment framework and how it really affects care providers, and some of the practical actionable tips to maintain and improve your CQC ratings in 2025. At that point, Mick and Flora will talk for around 20 to 25 minutes, at which point you are free to raise any questions by popping them into the chat facility during the presentation, and I'll drop my email address into the chat. If you wish to email me directly, I can ask any of those questions on your behalf anonymously. So I will ask that you mute yourselves, but please do put your cameras on if possible. After the presentation, I will facilitate a short Q&A session, and then you can raise your hands and ask any questions directly. We are recording the session, and our intention, as always, is to note any questions, to send a frequently asked questions Q&A session, plus a copy of the recording and any slides to you before the end of this week, depending on how many questions are raised, along with the contact details should you wish to reach out to any of our speakers directly. So without further ado, please let me hand over to Martin, who will share some of his thoughts on the current CQC regime. Martin.
Thanks very much, Richard, and good afternoon, everybody. And I'm really pleased that we're having this joint seminar today with Citation, because I don't need to tell people in the care sector that the regulator has been in crisis, and we saw all the challenges of regulation laid bare in Dr. Penny Dash's report. I think one of the challenges has been that many organisations have been many years between inspections, and often they are sat with ratings that don't represent what their services are actually delivering in terms of quality. There have also been significant challenges around both the single assessment framework, which at the start was unnecessarily complex and which the CQC themselves did not really understand, let alone care providers. We also had, of course, their disastrous attempt to engage in a more IT-based approach, and they managed to waste £92 million of our money on a platform that basically doesn't work. And so that created another challenge. I think there were also issues around low morale within the CQC itself, and also post-COVID, a lot of inspectors were going out to services, but because of the way in which CQC was managed, they were not actually writing the report on the services they'd been to, which was another fragmentation and another challenge within the regulatory system. Now, I have to say, we have been clear about all those problems and challenges, but I do think there is a bit of a glimmer of hope on the horizon in that there is a new leadership team at the CQC. So, for example, we have got now a new chair in Professor Sir Mike Richards, and he is establishing a new board. We have also got Sir Julian Hartley as the new chief executive, and he is appointing new chief inspectors in particular areas. Now, I saw both Sir Mike and Sir Julian last night, and even though they're going to have much more focus on specialty, even though they're going to have individual inspectors in charge, chief inspectors in charge of different areas, they are very conscious that they have to do read across the entire sector. So I do think there is hope on the horizon. But of course, in the meantime, care providers are left trying to make sure that their services are represented in terms of the real quality rather than the out-of-date assessment that was given by the CQC. And so as we move into a new CQC regime and we move into the new CQC way, as they're calling it, it's really important that care providers are up to speed with what the regulatory system is looking for and how you can present your services in the most positive way so you can get a good mark from CQC and have a good rating, because that is still very important, both in terms of how the general public perceive your services, but also how commissioners perceive your services. One of the reasons why I'm really pleased that we're working with Citation is because both Mick Feather and also Flora Neville have got absolutely fantastic experience. I mean, Mick has been around regulation, probably, Mick, I won't say how many years, but more years than we probably can all remember. And so he has a really good knowledge of the regulatory system. The other thing that's really great about working with Citation is they work with such a diverse group of care providers that they see how regulation and indeed a range of other issues are having an impact on the sector. So they bring all that knowledge together in terms of the diversity of their clients, and they're then able to give definitive views about how the regulatory system works. But most importantly, and the purpose of today's seminar, is really informing care providers about the new regulatory system, how it's going to pan out, and how you as providers can do your very best to make sure your services are shown in their best light and you can get a rating that really represents the quality of the services that you're providing. So it's great that we've got so many people on the webinar, and it's really great that we're working with Citation because they have a fantastic knowledge base on this. So I think that's all that I want to say by way of introduction, Richard, and I'm really looking forward to the seminar. So I'll hand back to you.
Thank you, Martin. I think it's really important that you give us that glimmer of hope, because we really need it at the moment, and it's greatly welcome. So yeah, thank you for your really helpful background and insight. Now, in the interest of time, please let me hand over straight away to Mick and Flora, who Martin has given a great introduction for. They will share their screens, fabulous, as if by magic. I will hand over to you to take away. Mick and Flora.
Brilliant. Thank you very much for letting us join you today. As ever, it's great to be partnering with you. I'm Flora Neville. I have no doubt spoke to some of you along the way, either in person, at a live event, or at a webinar. And I'll just let Mick introduce himself.
Hello, good afternoon, everybody. Thank you, Martin. Mick Feather, Care Business Manager for Citation.
Fantastic. Okay, I know a lot of you are familiar with Citation, but just I know there's maybe some here that are not. So just a very quick overview of who we are, so you know who is giving you the information. We are here to help you as an organisation to have a safe, happy, sustainable and productive business. It's about getting it right, guys. Employment law, health and safety, all your CQC. There's so much for you to do, and that's where we can help you to make sure that you get it right. It's about having the support as well. We have a 24/7 advice line. We've been helping clients for over 30 years to ensure that they get it right. So please do engage with us if you don't already, and we'll have that discussion. We're also part of the bigger Citation brand family as well, so you might well have come across us in some of those, or in future as well, whether it's UCheck or Cyber or whatever else. Okay, I'm going to hand straight over to Mick, to get stuck in. Thanks.
No problem at all, Flora. Thank you, Richard. Thank you, Martin. And thanks, Martin, because you've saved me a little bit of time already by talking about the fact that really CQC, in effect, are in special measures. If you think about the fact that the Penny Dash report, the CPA report, and the independent IT review, but we won't mention that at the moment. What I will say is just thank you, all of you, for doing what you do. You do the most important job that there is. And I always feel that it's important to start off with a big thank you to all of you for what you do. One thing to take away, if I just want to and seems a little bit light-hearted, but it's important. You guys work extremely hard at what you do. If you want something a little bit light-hearted, if you're feeling a little bit down and you want something to cheer you up, it was on the news last week. You can probably just go into Google, internet, and try and find it. But look up otters playing basketball. It's a wonderful thing. I think they've trained otters to actually play basketball. For 5 minutes, you can watch that and you'll just be calm. Right, okay. Martin has set the scene in terms of where the problems already lie. So in a nutshell, I'm not going to go into any of that. Basically, the problem has been using old ratings when you're not looking at all of the quality statements. And the reason why I've left that slide on is that James Bullion, who is actually still at the CQC, other people may have gone, but basically back in April of last year, he stated that the intention in actual key questions where the rating is inadequate or requires improvement, that they will look at all of the quality statements in that particular key question. So all of you are probably aware, you know, SAFE has got 8 quality statements, Effective's got 6, Caring's got 5, Responsive's got 7, and Well-Led's got 8. The difficulty has been, as Martin's already outlined really, is that they're not looking at all of the quality statements in a particular key question and potentially using old ratings. That's an issue. Even in a recent CQC slide that I've seen, this was from April of 25, it says the average quality statements that were being looked at was 18.8. Well, out of 34 quality statements, that's about half. So just as a takeaway for yourselves, try and identify what are they going to be looking at, and are they going to be looking at all of the quality statements rather than just looking at a few, because there are problems coming when they're not looking at all of the quality statements. Next slide, please, Flora. So what I'm, first of all, just a bit of scene setting really. So this, I basically look at reports on an annual basis, CQC reports. You'd think I've got something better to do, wouldn't you? But what I do is I try and identify issues, quick issues that are useful to you guys in terms of what to look at. You've got a million things to look at. What are the things that you need to be looking at? And what I want to do, first of all, is just reassure you, just because they got rid of Chloe's and called the Chloe's quality statements doesn't mean that you take your eye off the ball and do something different. As we look at what happened in 23 and what happened last year, you can see the similarities of what's going on. So in 2023, the top 2 issues were quality assurance and risk assessments. And in that well-known kind of Whiskers cat food advert, it says at the bottom of that slide, 8 out of 10 areas relate to safety. That's not a coincidence. Martin's already mentioned during COVID about this whole virtual monitoring idea. You'll remember that CQC are tending to look at safety and well-led, safety and well-led. That seems to be their thing. Next slide, please, Flora. If we look at 2023, what are the top 10 breaches? The top 2 are literally the things which were the top 10 in the top 10 of the areas. Regulation 17, quality assurance, and Regulation 12, risk assessments. That shows what the issues actually kind of were in 2023. There should be a drum roll now, but we haven't got a drum roll. So Flora, can you flick the next slide to see what happens for 2024? Oh dear, look at that. Not a lot of change. So single assessment framework. We've now got quality statements, not Chloe's. What's actually changed in terms of what inspectors are actually looking at? Not a lot, not an awful lot. The issues that are coming out. So I look at 50 reports. Out of 50 reports, 40 of them, there was a Regulation 17 quality assurance breach. And out of those 50, 27, so more than half, had issues around risk assessments. So for me, this is just a bit of a quick conversation around think about those areas and concentrate on those, because they're still areas which, regardless of the big change in terms of single assessment framework, that's where the areas where services are actually being picked up. So if we look at that top 5, and that's what I'll be showing in terms of CQC reports, staffing is 5, recruitment is 4, 3 medication, 2 risk assessments, and 1 quality assurance. We're going to look at all of those 5. But before we do, we'll look at a couple of things really, which are just bubbling outside that sort of top 5. Can I have the next slide, please, Flora? So one of the things, and one thing that you'll all remember, which strangely Martin's just mentioned in terms of the very negative culture or low morale in terms of CQC. Back in, I think it was 2023, CQC released a small little guide which was called Identifying and Responding to Closed Cultures. So they were very kind of, oh, we're going to go in and make sure everything is open and transparent, and there's nothing untoward going on. That's still a thing. So that's not been forgotten about. There are quality statements, and there they are. One's in safety, one's in well-led, which relate specifically to culture. One's about proactive, positive culture, about openness and honesty. And the one that's underneath in well-led is about a shared direction and understanding. What is the culture of the service? Is it transparent? Does it involve equality and human rights and diversity, inclusion, etc.? So don't take your finger off the ball in terms of sort of where you are with what's going on, because culture is still a thing. Can I have the next slide, please, Flora? And just to give you an example, so these quotes here are from CQC reports. They're not from Mick saying, oh, I think you ought to talk about this. These are actually from those reports where culture was an issue. I'm not going to go through all of these, but basically staff not encouraged and supported to raise concerns. Well, as you know from the press over the last few years, that is a real concern if staff are not open and if staff aren't able to actually raise concerns. It says here, we were not assured leaders acted with openness, honesty and transparency. So that whole idea that sometimes everyone has about open door policy, make that a reality. You can't change culture overnight, but certainly from the point of view of culture, still an issue with CQC. Don't let that slip. That is still bubbling under the top 5 things. And just to give you another example of what that is, can I have the next slide, please, Flora? The old phrase, which was under the Chloe's, which was about consistent improvement, it's still, in terms of what this is about, really important. So Martin mentioned during kind of COVID about the monitoring phone calls and about safety. And we all know that, CQC and local authority, because of resources, because of time, what are they going to focus on? They're going to focus on safety, and they're going to focus on the management of that safety. So learning culture is a quality statement. It says there, proactive and positive culture of safety based on openness and honesty. And it's got there about safety being as a top priority and involves everyone. And we'll talk about that a little bit later as we kind of like go through these slides. But can I have the next slide, please, Flora? Incidents and accidents. You can see what that relates to, obviously, directly regarding safety. Think about, not me, I was a nice inspector, but those inspectors that are not so nice are going to, find, if they talk to people, if they find out what's going on, and there are incidents or near misses or accidents that have happened that have not been reported, there will be potentially an issue about what else hasn't been reported. What other things are not being open and transparent about in terms of what's happened. So these again are quotes from CQC reports. Staff were not clear about how to report. Staff not always recorded incidents and accidents. Really vital. Make sure that's a thing. Make sure, certainly in terms of what that is, incidents and accidents, regardless of how minor or major, need to be, looked at, actioned. And as we've just looked at in terms of the previous slide, what are you going to do to actually improve what you're going to do for the future? So next slide, Flora, and we're into the top 5. So these are the top 5 things which we looked at in the original slide. So safe and effective staffing. So the CQC is saying in all their information regarding inspections that there are 3 areas that they'll look at. One of them is definitely this one. Doesn't matter what your inspection is, doesn't matter how many quality statements they are or aren't going to look at, they will look at safe and effective staffing. So in terms of what does that mean? In old money, so kind of sometimes in terms of Chloe's, that would always be about how many staff. And it isn't just about how many staff. Safe and effective staffing in terms of a quality statement is about all of those things at the underneath. Safe recruitment, staffing levels, the skills mix. Are they qualified? What's the training and development for those individuals? Are they being supported? Are they getting supervisions regularly? So think about it as a whole. It's not just how many staff. It's about, have they been recruited properly? Are they being trained properly? Are they being supervised properly? All of that whole element. And just remember that, as I say, safe and effective staffing is looked at every single inspection, regardless of what they're actually looking at. Next slide, please, Flora. So just to give you some examples from CQC reports regarding safe and effective staffing, these were the issues, some of the issues that came up. Supervision records we reviewed were generic. Staff didn't give, or staff were not given any feedback on their performance. Staffing levels, the obvious one, weren't adequate. It's got here, staff had not received all the training relevant to their role. You know, really important sort of elements of kind of the whole cycle of staff. So that's number 5. Next slide, please, Flora. So this is related. So it is related in terms of the previous one, but this is specific to Regulation 19 around safety and about recruitment. And this one comes up every single time I talk about recruitment in terms of care. There is a simple, just go onto Google, go onto the internet, you can look up CQC Regulation 19 requirements, and there's like a 2 or 3 page document which literally lists all of the things that you need to make sure that you've completed safe recruitment. And that's everything from photo ID to right to work in the UK to full employment history. So let's look at that bottom one. So in terms of kind of these are obviously from CQC reports. Some staff had not recorded their full employment history. So it's not last 2 years, last 5 years, last 10 years, it's full employment history. So back in the day, you know, it would have to be me when I was a paper boy. Fundamentally, some of the issues around this are around the fact of, you know, if you've got gaps in the employment history, what's going on in those gaps? What was happening in terms of what that is? And some of the other things that come up sometimes are around what's happening around the fact you've only got one reference. So let's say, for example, I've only got one reference for Flora. My own policy says that I should have 2. If you are struggling to get that other reference, and it might be that the individual's trying to get hold of it, it may well be, let's say, for example, the company's gone bust. So I don't know, it could be Woolworths or C&A or many others. Can't get hold of that. Get a generic risk assessment and write up, why is it that Flora's okay to stay and work here? If you're the actual manager, have they passed their probation? Have they done their training? Have there been any issues? What are the reasons for why you can't get that other reference? And sign that off so that you almost have 2 references rather than having a gap. Because, you know, not as nice inspectors as me would kind of pick you up on that, and they're going to say, fundamentally, you're saying you need 2 references, you've only got 1. You're not recruiting safely. So think about, you know, overall what we've spoken about: safety, well-led, safety and well-led. So if you've got a missing reference, that's not robust recruitment. Next slide, please, Flora. Medication management. Again, this is number 3 in our top 5. Again, becomes a safety thing, really important. What are these, you know, some of the issues? The same kind of ones yet again in terms of medication management, and I'll just pick them out. So it's the second bullet point down, PRN. So pro-re nata as and when required meds. So what's the protocols? What do staff need to know if, for example, Mick takes his prescribed medication, and that's fine, morning, lunchtime, evening. If, for example, Mick has a bad back and you give him a painkiller, how long are you going to give him that painkiller? And is it all noted about how long you're going to do that before you need to contact a GP to say, how's that going to impact on potentially my prescribed medication? So what's the actual communication and what is the actual procedure or guidance for staff about what to do about PRN meds? Don't forget about that, because it crops up quite a lot in terms of reports. The other one is the one down the bottom, which is about body maps. So body maps in terms of things like creams or pain patches. about making sure that, you know, are the creams going on in certain places? Are pain patches being moved and rotated as they kind of like should be? The CQC particular at the moment about what the actual medication is stating about how it ought to be used. You know, so fundamentally they're all, you know, you need to look at the guidance that's on that, and that's really what needs to happen, or else otherwise potentially there are, you know, issues. But medication, PRN meds, body maps. Next slide, please, Flora. We're getting very close now to kind of like, you know, the top two. Involving people to manage risks is the second quality statement, without a doubt, that as far as CQC are concerned, they're saying they will definitely look at involving people to manage risks, regardless of what they're actually looking at, because these are the most common quality statements that are looked at. So in terms of involving people to manage risks, we're really talking about risk assessments. So are they up to date? Are they relevant? Are they kind of dealing with and mitigating risks to people? So think about what that is. It's all about safety again. So that's really kind of like what they're looking at. Safety, safety well led, safety well led. Let's have a look. Can you click the next slide, please, Flora? So what are the issues in terms of risk assessments? Not manage the risks. Individualized detailed guidance had not been provided to staff about how to mitigate the risks. People didn't have up-to-date and accurate risk assessments. And this is the thing, you know, Flora started in a care home 6 months ago. You know, if potentially, you know, her mobility and continence or whatever has changed in that 6 months, risk assessments need to be put in place to actually sort of make sure that you're addressing what those are. So without a doubt, number two, in terms of sort of the big thing that CQC is still looking at, is about risk assessments. And we know that risk assessments are kind of, you know, boring in terms of what it is, but it's the most fundamental way of understanding how you make sure you mitigate risks to individuals in terms of vulnerability. And I think, certainly from my point of view, you've got a care plan, great big, you know, document, loads of paperwork in terms of what that is. You've got a risk assessment about the risk and potential risk for those individuals. And then potentially you could have like a staff guidance. So, you know, what's the staff guidance? Rather than me looking at, you know, 50 pages of care plan and a 30-page risk assessment, what have I got to do to make sure that I provide Flora the best care that I can right now? Not from 2 months ago, right now. Next slide, please, Flora. And I think we're at number one. We are. So in the good old days, Chloe days, you'd remember good governance. That's what they would kind of like term this as. In terms of this quality statement, governance, management and sustainability, it's really good governance and quality assurance. But what that is, and here's the difficult one, is that the actual quality assurance kind of statement in terms of the definition is literally everything. So if you look at what that says, it's about effective governance, management, accountability, systems, manage current performance, risk, data, notifications, robust arrangements for integrity, confidentiality of data, leaders implement mandatory quality frame. It's absolutely everything. I mean, if I had a kind of a very easy way of being able to say to you, right, okay, then if you want to sort out quality assurance, you just need to do this, I would tell you. What I would say to you would be one of the ways is about making sure that you're aware as managers about exactly what's going on in the service. And it doesn't matter who it is who's telling you. Everybody needs to be keeping you up to date with what's happening so that there are no surprises. Because we, you know, fundamentally, when you get issues regarding, you know, quality assurance, it will be usually kind of termed around the fact that, oh yes, we've inspected here and the registered manager Flora didn't know that this was an issue here and this was an issue and this was an issue. If you're aware of those issues, it's about, yes, we're aware of those issues and we're doing this about it, is a better conversation than it being brought up by the inspector. Because fundamentally it means that you're on top of what's going on. And it's a difficult thing. With all the things that you've got to do, quality assurance is about you being aware of everything that's going on in your service at any given moment in time. And that's quite a difficult ask. Next slide, please, Flora. So let's have a look at some examples in terms of the CQC report for quality assurance. What are the issues? Themes and trends were not always identified. I mean, there might not always be a theme and a trend. One person might fall in 1 month and that's it, and they don't fall in the next month. It may be that Mick got a UTI in that month, therefore there's not a real theme and a trend. It was dealt with and it's sorted out. If it's, I don't know, something in the garden which everyone's tripping over every 5 minutes, that's potentially kind of like a pattern and something that needs to be kind of like resolved. But a lot of the issues here about the fact of not having oversight. It says their provider didn't have oversight of the service, audits undertaken weren't very good, managers didn't provide assurance that governance processes were robust, so there was a lack of evidence around how improvements were being made. One of the things, and I think you probably already do it yourselves, after a 6-month period or at the end of the year, what if you had an A4 sheet, what are the things that you're going to improve for next year? We're going to do this, or we're going to do that, or we're going to do this. Because it gives you that level of, this is what we've done, this is what we're planning to do, and this is how we're going to improve. Right, I'm just going to go over a few things now which you still need to be aware of in terms of kind of like single assessment framework, and then I'll be done. So next slide, please, Flora. So these things haven't gone away either. They've just been renamed under a different quality statement, but let's have a look and see what they are. So first one, under caring, workforce wellbeing enablement. So things like employee assistance programs, or making sure, I don't know, you've got champions for mental health, or if you're making sure that there is, I don't know, member of the care workers charity, whatever it might be, how you're supported. Member of Care England, member of Skills for Care in terms of trying to get some support. How are you looking after your workforce is not forgotten about. It is a quality statement under caring. The middle one there, and as someone who is very aware and used to be a manager of equality and diversity, really important in terms of understanding and valuing the diversity of your staff. I would go as far as to say also your service users. So to be quite honest, residents and clients, it's about whether those things are important to them. Because if they are important and you've missed that, that potentially is an issue. I'm hoping that's going to make sense. So what I mean by that is, in terms of things like equality and diversity, although obviously over in America, it tends to be something which they may seem as not important, it still is over here. It's still really important. And that one definitely says in terms of quality statement about making sure you value the diversity of your workforce. And as I said, I would extend that to sort of service users. If you've got a service user who may have a particular religion, or in terms of whether LGBT, if that's important to them, and it doesn't have to be, remember, anything to do with equality is, there's always that, you can ask the question, but if they don't want to respond, then they can say, well, I don't want to answer that. Well, that's fair enough, you've asked the question. But if it's really important that I go to a Christian church or to a mosque, or if it's important that I go to Pride, don't allow that to be picked up by an inspector. That should be something that is, if it's important to those individuals, it's about making sure you can do whatever you can. And I think certainly equality issues, and certainly in my mind, were gold dust in terms of that road to outstanding. When we talk about things like what are the good things you can be doing in terms of trying to get to that outstanding area, anything to do with equality and diversity is absolute gold dust. And it certainly was for me as an inspector. Anything that you're doing in terms of those things are absolute. I can give an example, and this isn't even about equality, but extend this or see this as equality. I remember seeing a survey form where this is a domiciliary care agency, and the person had put, Alex has changed my life. So I said, who's Alex and what's going on with, let's call her Mrs. Brown. Alex was a member of staff. He'd gone round to Mrs. Brown's to do his usual visit. She'd mentioned to him that she really loved painting and drawing when she was younger. Alex had gone home that night, gone onto Google, found out that Age Concern had got an actual weekly kind of drawing and painting class, and had then gone back the following day and said to Mrs. Brown, I don't know whether you're interested, but there's an Age Concern painting and drawing class. Alex has changed my life. Now that may not seem important, but it's absolutely invaluable. and certainly, extend that in terms of equality and diversity. Last one that's on that page is learning, improvement, and innovation. And it's the usual thing, continual development. So what that's about is about continuously learning from what you're doing, and then fundamentally making sure that you put those changes into play to actually improve what you're doing. Okay, last couple of slides then, please, Flora. Next slide. So this one, environmental sustainability. I mean, we could do a presentation purely about the pros and cons about single assessment framework. We're not going to do that. All I'm going to say to you is that in terms of this one, so let's see how this came about. So this was technically quality statement number 34. So last year, CQC said, oh, look, don't worry, adult social care, don't worry about environmental sustainability, because we know that you need some time to try and get with it in terms of environmental sustainability. The reason for that is that when you obviously have, NHS trusts, hospitals, adult social care, dentists, etc., everybody in one framework, NHS trusts have got a green paper saying that they need to be environmentally sustainable and they need to be doing an awful lot of work in terms of the environment. That might not affect Mick and Flora's little dom care. I haven't got that capability. The local hospital here, down the road from me here, the whole of the roof of the car park is made up of solar panels. And it actually provides 50% of the power for that hospital. Now, I can't do that in Mick and Flora's little dom care. However, that's the reason why last year you were almost told, don't worry about it. They will probably be asking about it, certainly this year, if you're inspected. So think about what is your carbon footprint, what kind of things should you be doing and thinking about, even if it's getting a recycling bin, even if it's reducing the amount of paper that you might be using in terms of what you're doing. Can you flick the next slide, please, Flora? So these are the sort of things, and some of these are not even doable if you're a small business, but just think about, what do we do? I would suggest probably having a meeting with staff. You're bound to have people that are going to be able to say, what can we do, better in terms of environment, in terms of what, even if it's small things, so that you're able to say when the inspector calls, yeah, we're aware of environmental sustainability. We understand what we probably need to do. We need to think about doing these kind of things, and we're actually putting some of these in place. So don't allow that to be a surprise for you, because I think they're going to start picking up on exactly that. So last slide, please, Flora. Okay, create a safety culture. Mick, what are you talking about? So I've been talking about this for some time. Look at this. Don't you just enjoy someone who's got slides that are out of date? NHS England, who's that? So NHS England spoke about safety culture. IOSH spoke about safety culture. So Health and Safety Executive, and even the CQC are speaking about safety culture. What does it mean, Mick? What's it all about? So if we were doing health and safety, and I said, who's responsible for health and safety? Sometimes people would point to a health and safety manager and say, oh, it's them over there. And obviously the person that's at the back, very clever, puts their hand up and says, everybody's responsible for health and safety. And that's exactly what this is talking about. Safety culture is about the fact of everyone's got a responsibility for safety. So in terms of trying to answer some of those questions around quality assurance and what you can do to try and improve that or whatever, everybody, so all staff, and all regardless of what that stuff are, even individuals that visit and whatever, everyone's responsible to actually making the place safe. So it's really about what on earth you can do to make sure it's an open door for you, for people to be able to say, this is what I think we ought to be doing. Why aren't we doing this? Because there's an issue in terms of safety, for you to be able to look at what that is, because creating a safety culture will fundamentally help in terms of trying to get an overall safety aspect about what is going on in terms of the service. Last slide then, Flora. I think it's just summary. Is it? I think it is. Quality assurance, we've done that. Risk assessments, those are the top things for you to take away. Remember, concentrate on them. Environment and sustainability, and creating a safety culture. I think that is it. I am done. Thank you. I think we're going now back to Richard. Thank you.
Thank you very much, Mick. That was amazing, and I'm going to have to look up the otters video, but not when I'm on a webinar. I think what you've talked through is just phenomenal, and you've made it really digestible and easy to understand. Picking up exactly, you know, Regulation 12, Regulation 17, safe and well-led, key focus areas, you know, safe and effective training, recruitment checks, evidence, right to work, references, meds management, you know, making sure the notes, the PRM point, really important point that hadn't kind of come through from other areas. So that's a really good point. And the patch rotation, something as simple as that, they're things that you can very easily, you know, peel one off. If you're not recording it, you might be rotated. If you're not recording it, you know, these things are really required. And quality statement 34 for me is a really important one. It's a bit of a passion one for me. And I know someone in the chat put in about some recycling regs coming in March 25 with food waste recycling. Having that carbon plan, knowing what your current carbon emissions are, it doesn't have to be perfect, but just knowing what some of your carbon emissions are and having a plan to do something about it. You don't have to suddenly pave your roof with grass or solar panels to show you doing something. So really phenomenal. We have had a few questions come in, but just a massive thank you first of all. First question we had was if there are any templates that you've got available to help on the clinical governance oversight point.
So, I mean, I don't know, but was that regarding medication?
On clinical governance, it came in the medication point, yes.
Okay. I mean, I don't know. I mean, I think I think in terms of citation, we do have some basic medication ones. Certainly from the point of view of what I would suggest is I would probably create the ones that we know that you just spoke about, Richard. So a PRN one is like, and it's going to be specific to individuals. So in other words, what's the PRN guidance for this individual as opposed to another one? But no, I mean, I'm not aware. I think we've got some basic ones, but they're around, you know, destroying and the waste management of medication rather than kind of like specific. So body maps you can kind of like get easily on the internet in terms of what that is. So that's a simple thing. But I think probably you need to just come up with a sort of almost a small little template about what is the needs for Richard in terms of PRN meds as opposed to Mick, as opposed to someone else.
Fantastic. Well, that's really helpful. And this is one that's come up, and we raised this with the CQC recently. Martin and I did on a call when Martin coordinated a call for the board with Sir Julian Hartley. This one came in as a consequence of the falling number of inspections. We know we've got challenges at the CQC to get through the inspections. Will the local authority PAMS process gradually take over the inspection process? Do you have a thought on that, Mick?
I don't think it will. I mean, personally speaking, I think local authority quality assurance inspections are really useful. And the reason why I think so is just from my point of view. Sometimes there's one of the issues that I had in terms of when I was inspector is that as the regulator, you almost tell people these are the things that are wrong, but you don't give people probably enough information to support them in terms of how to put it right. And I think sometimes local authorities are very good and PAMS in terms of being able to sort of say, look, you might want to look at this, or you might want to do this. And I think they're really useful. So I think they're going to go hand in hand. I don't think the regulator is going to go away, but I do think that local authority inspections are useful.
Yeah, really helpful. No, we're very much agreeing with you. And I think the CQC came back and said that on some, James Bullion actually said, the CQC have looked at some of the PAMS assessments, and some of them are absolutely spot on and match really well, and they did a really good job. Some of them were bleeding awful, and you know, they were saying good, and CQC was saying requires improvement adequate. So I think it really depends on the skills of the individual conducting the assessment, to your point.
I think you're exactly right. And the difficulty is, as we all know, is that all local authorities are all different and they all love to be different. And the difficulty with that is that they'll end up with even, you know, less consistency with their reports than the CQC do.
Absolutely. And yeah, Richard's put a comment in there around the statutory legislation be required to make that change, which is not going to happen. And it will certainly take 2 or 3 years for that to happen anyway. Another question, in the 2000, it was more of a statement really, in the 2017 Chloe's staff was put into the safety loop. The CQC should be able to offer guidance on what works and what doesn't. I don't know if you want to comment on that, Mick.
So what works and what doesn't in terms of recruitment or? Well,
the Chloe's previously in the Chloe's, safety was put in the loop. Staffing was put into the loop of safety really. So some of the staffing things So CQC should be able to direct what works and what doesn't work. But what would you believe? Unless, of course, whoever put that question in the chat wants to kind of.
I think,
Richard, if you want to answer that question directly, please come yourself off mute. Can we take the slides down, please? Is that okay?
Yeah, of course.
Brilliant. Richard, I don't know if you want to pop in on that one. Richard maybe just struggling, but we'll go on to another and we'll come back to the one.
Okay.
Mary's put in the chat, how do you suggest we manage the lack of references for displaced workers?
Yeah,
Good
I mean, that's a really good. Yeah, it's a really good question, Mary, because we know that there are quite a few of them. I mean, that's really difficult. And really a lot of that is going to be around overseas recruitment rather than potentially what I was talking about in terms of people who have worked in this country prior to kind of like being in care. How on earth you kind of like potentially would get sort of references from, people that may have come, farther afield in terms of overseas is even more difficult than it is, with individuals that have worked in this country. I don't know the answer to that. Oh no, Richard hasn't got a mic, he says.
No, that's it. I've asked if you can pop that into a slightly clearer question. But I think one of the other points that's come across is the duplications. I'm just checking my emails as well because they're coming in from different angles around the duplication of requests for information in the quality statement. So you might have to provide the same information in multiple quality statements. So you said where to focus, but actually just because you put it in one, it doesn't mean you don't put it in others. What are your sort of thoughts and suggestions around that?
Yeah, I mean, there's always been overlap. Even with the Chloe's, there most definitely, has been. I think for me, it's about you probably feeling where it's most appropriate. But a lot of the time, it's you literally have to probably copy and paste information and evidence from one bit and put it in another bit as well, because they will overlap without a doubt.
But when you said previously they're looking at an average of 18 or 19 statements, just because you've got your full 34 all sort of written out, documented, don't assume that they're going to look at where you've put the evidence. You need to duplicate and reference it because they might not be looking at the statement where you provided the evidence. I think that's the point as well, isn't it?
Without a doubt. Totally agree.
And another one, on the day of the inspection, sometimes the inspectors will want to talk to staff, and some staff are really uncomfortable with that. Have you got any sort of thoughts and suggestions around how we can, to what limit can we expect staff to engage with the inspector?
So there's a few things really. I mean, certainly you could do a mock inspection. So a lot of places, including Citation, will do mock inspections to kind of like try and, because you can almost set it up as an inspection as if it's like the CQC. What I would do if you're due an inspection, and certainly, it's difficult to work that out at the moment in terms of frequency. Usually, you're still going to get sent your PIR in terms of sort of what that is. But what I would say is that you probably need to start doing in your staff meetings or whatever, having sessions about what are the issues or what are the things that potentially CQC are going to ask. So it's not necessarily about knowing all of the 34 quality statements, but if I was still an inspector, I'd be asking staff, think about the basic things. Do they understand safeguarding? Who do they report it to? In the event of a fire, what do you do? Do you know what I mean? All of those issues, and certainly related to safety, what do staff know about those things? Do they understand a little bit about capacity and what they do need to know about individuals? Those are the things. And you don't need to do big training courses on it. Make it part of the staff meeting. What's your issue, Richard, if the CQC came in? What would you be worried about? Would you be worried about saying the wrong thing? Do you know what I mean? Just do a few of them. Do a few of them to get it. You could do a mock inspection, but that's a big thing. What you can do is you can talk to staff about what would be their issues. What are their most frightening things?
Oh, thank you. Yeah. Diane's actually put a comment in the chat as well. One of the key areas is involvement. Do you have any advice for people on evidencing involvement? How the best way to evidence involvement?
So you're talking involvement in terms of community when you're saying that, Diane, or?
Diane, if you want to come off mute. Maybe Diane can't come off mute, but let's go with community.
I can. Here I am.
Okay.
Hi, Mick. Mick,
hello.
Involvement runs through like a thread in the key questions. So we
so
do
involving
things
the
like
service user, you mean?
Yeah, but
Right.
I think our colleagues as well, because I think, and we've got surveys, we do things like resident of the day and things like that. But they're always looking at the moment for evidence around involvement. And I've got some standard stuff. I just wondered if you had anything else.
I think you sound, Diane, like you're doing exactly what you should be doing. I mean, in terms of stuff like surveys, residents' meetings, staff meetings, when we talk about involvement, I mean, the far end of the scale in terms of real involvement is, if you're running learning disability services, that you have your individual service users on the panel deciding about who's going to get the job. Do you know what I mean? That's real, proper kind of involvement about what's going on. So think about it from those terms. How, that being a kind of end goal, what things would you need to do? And that's about regular kind of like, even feedback on a regular basis. Forget about these sort of annual, twice a year surveys. How often are you talking to kind of, residents and staff about what, needs to be done? Because those are the things. And even talk to, family and friends survey. What do they think? Because it might be totally different to what service users and your staff think. So I sort of think get it from all angles and get it as much as you can. And that allows you to say, when anyone calls, well, what are you doing about involvement? Well, we did a survey 2 years ago. Well, that's no good. Last week we did a resident survey. We did a staff survey, only 2 weeks ago. We had family and friends, and they told us all of this. We're now working on all of that as a plan. And I think that, plus anything that you can do in terms of sort of involving, community. Well, I think you are already if you're using family and friends, aren't you? Diane, you're about to say something.
Yeah, Mick, do you know what? I think it's interesting at the moment because the CQC are using this hybrid version of inspecting where they're sort of writing up stuff under the quality statement, under one quality statement, but they're actually, I think, still scoring under the evidence outcomes. And because those evidence outcomes, one of them is clearly about feedback and sort of involvement. I think that's why it keeps coming up, and I think people need to be very clear that they need evidence around that. And it's not transparent at the moment, really, how they're scoring us.
I mean, going back to what Martin said at the start, and I mean, I've got my own opinion about, in terms of what it is. I did speak to James Bullion actually at the Care England conference. I mean, I personally think they've abandoned scoring on evidence. I think they're going to get rid of scoring full stop. So I think potentially when they eventually come up with a provider's guide to actually let all of us know what does outstanding, good, requires improvement and inadequate actually look like, because that's what they started with Chloe's. You start off with that so you know where you are, and then you start seeing who's required. They haven't got that yet. They're still working on that. I think it was supposed to be the end of May as part of the CQC way. We haven't got it yet. If you know what outstanding looks like, it will then give you a great idea, Diane, wouldn't it, about how you get involvement in what's going on. I think it's too complicated for providers in terms of the whole scoring thing. I think it will go back to me as an inspector saying, I think, Diane, your service is good because that, and it matches the characteristics of good in the provider guide that we haven't got.
Yeah. Well, I fed back on that draft document that they put out, which was a very interesting read because it lacked guidance under outstanding. I thought it was very focused on
probably because they don't know. They probably
on
don't know,
on the lower end, shall we say? Yeah. And I fed back on that to people, and as I say, and I wanted to get involved, but they haven't come back to me at all. But it is sort of akin to the characteristics of ratings under the Chloe's, which providers didn't use enough to use as challenges, really. But there we are. We'll see what they come out with.
Diane, I'm going to move on if that's okay, because I'm
conscious
of more questions to come in. But record. So where you've got this involvement, record it, put it on file, have it ready. Another question, Mick. Again, we've got a couple more now, so we can keep them quite succinct. That'd be great. Okay. Has the use of digital care plans impacted on the quality of care? Has it improved from what has been seen and published in the CQC reports? Are we seeing evidence that these digital care records are making a difference?
So, I mean, all I can say is the fact that it probably depends on what care planning system it is. I have seen in reports, and all of you are probably aware of it, and I would always say this, no matter, I mean, we don't do a care planning system. However, if you get one, it needs to be something that you can all use and which is going to be beneficial and which is going to improve care. If it doesn't do that, then I have seen reports last year where basically digital care planning has actually made their rating diminished as a result of we got it on paper, we've got it on digital, no one really knows which one's which, and it's all confusing. So don't do it for that reason. Whether it's improved care, as I say, it really depends on what kind of care planning system you got.
Brilliant, thank you. And I think just to quickly respond to Mary's point, Mary, you said so this will be in the imminent provider workbook. Yes, I believe that's correct. So we as Care England have been asked under the Care Provider Alliance, we've been commissioned to work with the CQC on providing the handbook of what good and outstanding will look like. So yes, I believe that is the case. That commission hasn't come through and finalised yet. So I think it's going to be at some point later this year, but we're still waiting for that commission to come through.
I think you're right, Richard. I would say to all of you, as much involvement as you can with CQC to try and help them out of the hole that they've got themselves in, I'd say.
Absolutely. Richard did come back and say the place of feedback is a trigger for investigation by the authorised person where currently is processed as evidence but is withheld
from the registered manager.
Registered manager, yes, sorry. Took me a while to read that one. Any response to that, Mick?
The place of feedback is a trigger for investigation. I'm trying to. What was the previous question? Because I'm trying to put that into.
In terms of the previous question, that was, I've lost myself now.
Are we talking about safeguarding here now? Or are we talking about something else?
Unfortunately, Richard can't come off mute, so maybe Richard can drop us an email on that one, and we'll clarify back to him afterwards. I am going to draw the session to a close and just thank everyone for joining. Thank you, Mick and Flora, for organising and putting this together. The slides and a copy of the recording will be made available very quickly. We will just pick up that question from Richard in the meantime, if you want to clarify via email, and we'll respond afterwards on that point. But huge thank you to Martin, huge thank you to Mick. It's been really, really helpful and insightful to understand what you've seen from those sort of 50 reports that you've gone through and all the wider work you've done on this. We'll get those slides and recording out very quickly because there's no reason why we can't. If you've enjoyed this webinar, then please do look at our events page. There are future webinars coming up. Citation send a huge amount of information out. So please make sure you're registered on our mailing list. If you're not on our mailing list, just drop one of the team an email and we'll make sure that you are added and that you receive the fantastic information that Citation and some of our other partners share. So huge thanks to you, Mick, Flora.
Thank you, Richard. Thank you, Martin. Thanks, Flora.
You guys.
Take care all. Thank you.
Bye.
Thank you all.